Nurse. I'm Pat Williams with Dr. Benjamin Bryant, Chief of Staff and Chief General Surgeon here at Conneaut Medical Center. Well, Doc, the baseball season has started.
Holy smokes.
And you know what? That means summer's right around the corner.
Well, you know, it's been warm for enough days
Yep.
in a row now that I might be starting to be a believer.
Yeah, I agree with you.
Yeah, you see the blooms coming out on the trees. It's pretty nice.
Yep, yeah. See, we got a guest this morning.
Hello.
Well, Pat, I am really delighted. Now, Marie, I'm going to pronounce your last name.
Gerecke.
Gerecke.
I get all sorts of
I'm
iterations.
glad you did that first because I would have
Butchered it.
I would have butchered it.
There's a lot of E's in
Yeah.
that name.
Well, Marie Gerecke is a nurse practitioner with Dr. Sam Ahuja, and they provide OBGYN services in Ashtabula County. And we were really pleased that Marie was going to take the time to be with us today. OBGYN services have, for the last several years, really sort of been underrepresented in the Conneaut community, and from what I understand, that's about to change. Marie, could you tell us actually what your role is in the practice that you're with?
Sure. So Dr. Ahuja and I collaborate. So we see patients out of all three of our offices. We do have an office in Mentor, one in Geneva Medical Center, and then one as well in Ashtabula at the facility there. Although that location is about to change locations.
Right.
So shortly we will be located in the mall in Ashtabula. And so basically, you know, we both see patients in the office, never on the same day, so that we don't bump into each other too much. And I do the vast majority of what Dr. Ahuja does in the office, you know, seeing patients for annual exams. I help care for pregnant patients as well, and typically we alternate pregnancy visits, one with Dr. Ahuja, the next with me. And then I also work with Dr. Ahuja to refer patients that I think need a physician's care for surgery or consultation. And we collaborate over the phone and, you know, to make sure that patients are getting the care that they need.
So you have quite a bit of responsibility in the practice.
Yeah, absolutely. And that's one of the nice things about being a nurse practitioner is that, you know, I am you know, one of the things they like to say in nursing school is the nurse practitioners, and I'm also a nurse midwife, are professionals in the normal. So I take care of, you know, healthy women, and I'm, you know, able to identify things that fall out of the range of normal, and then make clinical decisions based on that and involve the care of a physician if it warrants it.
So what kind of training do you have to go through to get into this position?
So over time that has changed a little bit. I have a master's degree from Ohio State University. They are changing the laws now so that new graduates will need a doctorate in nursing to be able to practice as a nurse practitioner. I luckily scraped by before that rule took place. But the vast majority are at least master's trained in the state of Ohio in nursing. And so a nurse practitioner or a certified nurse midwife will be a nurse, an RN, and then they will also have an advanced degree in an area of specialty. In mine is women's health and also nurse midwifery.
So we're talking about a fairly lengthy education process to get where you are.
Absolutely, and a lot of clinical hours in the hospital and in office settings, studying both, you know, pregnancy care and gynecologic care.
Well, I think it's important for people to realize that nurse practitioners, this is someone with a lot of training, a lot of experience, a lot of expertise, and so many things in medicine would be addressed the same by a nurse practitioner as they would be by a physician.
Absolutely.
I mean, like, no difference.
Yep.
There's, you know, and that's true in any field, OBGYN and any field in which nurse practitioners operate. So I think it's really important for the public to realize that these are accomplished professionals in their own right who know what they're doing.
Yep.
Now, there are going to be a percentage of cases, 10%, 15% maybe, that are complicated. that have other things going on and that require the level of training and experience that a physician has. But that's a small percentage within any field, really. And one of your responsibilities, Marie, is to know the difference.
Absolutely.
And that's, I'm sure, emphasized in your training so that you know
Yep.
how to make those distinctions.
Yep, exactly. And it's nice to have two eyes on a patient, and that's essentially what you get when you see a nurse practitioner or a nurse midwife. Whenever anything strays from the norm, or if I have a question, I always have Dr. Ahuja to help me make decisions or to give me his opinion on what he thinks the best route is, and we really work together to ensure that patients have quality care, they're getting the care that they need, a care plan that makes sense for the patient and their family. So it's nice to have both sides of the spectrum with a physician and a nurse practitioner.
I'd like to go back just a little bit, Marie, and number one, I guess, you say that you're changing locations
Yes.
from...
So we have our office in Mentor, which is not changing. Our office in Geneva Medical Center, not changing. But our location in Ashtabula is actually moving slightly closer to Conneaut, one exit closer on the highway, over to the Ashtabula Mall, because UH is setting up a healthcare center there for various offices, and that includes the OBGYN office that Dr. Ahuja and I work out of.
That's
UH has had a center that's sort of kitty corner from ACMC.
right.
Okay, that, in that area there. But there were various reasons why that location needed to be changed. And so what UH did was they made a decision to move to the mall and set up the entire infrastructure out there. So that's what's meant by the change there. And that's not just true for her, but that's for everything that UH does in Ashtabula.
Okay, and when will that take effect, Doc?
Marie might know that better than me.
According to the most recent email, sometime at the beginning of May is when we'll start moving over, yeah. And that includes the urgent care, the lab services, radiology, pediatrics, all of those different offices will be moved to the mall.
That's big news.
Yeah, this is big news. It's been in the works for a while.
Okay.
Obviously, you don't just make a move like that without a great deal of planning and preparation and so on. But it's closer to fruition than I realized, and and that is a big deal. I'm sure there'll be a big announcement.
Yeah, I think they're planning on contacting patients and making some bulletins and things so that patients in the area know that we're not going to be there anymore on Lake Avenue.
Okay. Doc, you mentioned too that it's been a while since you've had women's care here.
Yes.
Now, what does this mean? I mean, this doesn't mean you're going to be delivering babies or anything, right?
Not here. No.
Okay.
That's a huge subject. I mean, for a hospital to get to the point where it's going to have actual obstetrical services, there's a tremendous amount that goes into that.
Okay, I just want to make that clear.
And we Marie can make that clear to the public that no, we're not talking about delivering babies at our hospital.
Okay. Right. There's been a big movement in the medical world to centralizing labor and delivery services, and so a lot of smaller community hospitals, it takes a lot, like Dr. Bryant said, to run a labor and delivery unit.
It's very expensive.
Very expensive, and so what a lot of hospitals are doing, number one, to save money, but also to improve the care of women and babies on a labor and delivery unit, is that they're centralizing labor and delivery services so that there's better access to lab services, diagnostic testing, in-house anesthesia, some of these things that we need when we're caring for women in pregnancy. And so some of these smaller community hospitals, unfortunately, don't no longer have labor and delivery services, and this is true across the entire country. It's unfortunate because women have to travel a little bit farther to get care during labor, but it does improve the care once they are there in terms of having access to a wide range of services.
That's very important.
How much will you be accessible at the new location?
So as of this month, in the past I've been there 2 Saturdays a month in Ashtabula, which is nice for women who work and don't want to take time off of work for their annual exam or something like that. So on Saturdays I'm there 2 random Saturdays that I pick based on my very limited social schedule, and I'm there from noon to 4, sometimes a little bit later. And then starting this month, April, we will I will be going there on Friday mornings as well from 9:30 to 12:30 to see patients 2 Fridays a month. And that will probably expand as my schedule fills up, and I may start to increase the number of Fridays that I'm there. But for now, it'll be 2 Fridays a month, just in the mornings.
But it'll be staffed all week long with other staff.
So we have a staff every day of the week at our mentor location, but because this is a timeshare that we use, there will be other offices using that same space. So for OBGYN services, we are only there so about 5 days a month that we will actually be there.
Okay.
Well, let's, okay, all right. So our public here in Conneaut, okay, well, it's easier for me to get there now. You know, I can just shoot over to 11 and drop down and get off and boom, I'm right there. So it's easier for them to get there. Okay, so now people are coming over, you're seeing patients on Fridays, people are coming over on Saturdays, and here it is, it's an off day, you're not in the Ashtabula location, and a Conneaut patient has a question for you.
Sure.
What do they do?
They can call our central office location, which is Mentor. The number is 440-205-5870, and they will get a hold of our office staff. They can speak to a nurse. The nurse will either grab me or hand me a message if I'm in a room with a patient, and typically we get back to you within the same day if we can. And then we make a lot of same-day appointments, and that's one of the nice things about our office. If you are due for your annual exam or you're having some kind of a problem, pain or something unusual like that, we really work to squeeze people into our schedules and make sure that they can be seen the same day. And
that's terrific.
And any woman knows that there have been times that they've called an OBGYN office and they've said, it's going to be 4 months till you get to see the doctor for your annual exam, and we really work to make sure that doesn't happen for our patients. So that's one of the nice things about our practices. We really try to get people in.
Well, I think you're sort of exercising leadership in that, although this is becoming an imperative throughout the UH system.
Absolutely.
UH is very, you've heard it on this show many times, UH is very forward-thinking, and we understand that there are certain things that patients want, okay? And patient satisfaction, which has a number of different components. How easy is it for me to talk to the doctor? How quickly can I be seen? How well do they explain things to me? How comfortable do they make me feel? How much do they tell me about what their plans are and why, and all the outcomes and that sort of thing. That patient satisfaction is really driving healthcare now.
Absolutely.
And it's going to do more and more and more. And what we're hearing here is responsiveness to that.
Absolutely. And even if we're not in the Ashtabula office on the day that you need to be seen, our Geneva office, Dr. Ahuja and I are both there 2 days a week, so that's a little bit closer. And then as a last resort, the Mentor office, which we are there 3 days a week. So we, like I said, we kind of rotate offices, so hopefully there will be someone relatively close by that can get you in.
So if a Conneaut patient needs to, well, they talk to you and it becomes clear that, whoa, maybe they need to be seen. It's not enough that they need to go to an emergency room.
Right.
But it's something that should be addressed definitely sooner rather than later.
Absolutely.
That patient might have to go to Geneva, but conceivably could go to Geneva and be seen.
Absolutely, yeah. Dr. Ahuja is there on Mondays all day. I'm there on Wednesday afternoons, starting at 1 p.m. So we have a lot of flexibility in our locations, and we do have a lot of patients that live out in Conneaut but work a little bit closer to Cleveland, and so for them it's easy to go on their way to or from work to stop at one of our locations that's a little bit farther west. So we have a lot of patients that choose to be seen at our Mentor office just because they work in that area. So that's a nice benefit to having some multiple locations. That's really true. So, and we found over time that, it's with our public there are some driving issues in some cases. But Geneva is certainly doable. Absolutely.
Driving to Geneva is not like driving to downtown Cleveland.
Yeah, absolutely. And we do know that some insurance providers do cover vouchers for getting to and from medical appointments. So that's something
important.
that you can always look into if you feel like getting to your appointment is going to be a difficulty. And we're very flexible. If someone has car trouble or they just can't make it that day, we have a lot of patients who are calling and saying, I'm going to be a little bit late, and we're very accommodating with that. We try to, even if you're late, we try to be able to see people. It's nice if you're on time, so we appreciate that. But we understand that life happens.
And the other patients do too.
Yeah, absolutely.
Yeah. What proportion of your practice would you say is related to obstetrics, and what proportion is related to GYN? What's the difference between those two things?
Sure. So obstetrics is the care of a woman during pregnancy, and so I'd say, depending on which office I'm at, anywhere from 25 to 50% of my patient load that day would be caring for a pregnant woman, and then gynecologic care is caring for women's needs specifically. So pap smears, breast exams, those kinds of things, contraceptive care. And I'd say, especially out here when I'm in the Ashtabula office, almost predominantly do I see gynecologic patients in our Ashtabula office. And so it varies day to day, and it varies according to the location.
So you'll be taking in ladies that are pregnant.
Absolutely.
And during the term, and then they obviously will have to go to another location to have the baby.
Yep, our practice, Dr. Ahuja delivers at Geauga Hospital. I am a midwife, so I have delivered babies in the past, but I have 2 little ones of my own, and so I'm not taking call currently. I have privileges at Geauga, so I'm able to admit patients there if need be, and probably in the future that's something that Dr. Ahuja and I will work out, but I have a 4-month-old at home, so she needs me during the middle of the night a little bit more than
So
than
the
others.
girl you just had.
Yeah, my newest little one. So Dr. Ahuja delivers all of his own patients, which is another benefit to our practice in that you don't have 8 or 9 physicians or midwives and it's luck of the draw. Dr. Ahuja will care for you during your labor and during the delivery unless he's on vacation or something, and he always lets our patients know about that. Geauga Hospital has a really nice labor and delivery unit, really great staff. Some of our own staff in our office have had their babies there and have had really great experiences. So I will care for women during their pregnancy with office visits, and Dr. Ahuja takes over when it's time to have a baby. So.
Well, I think that also illustrates the commitment that University Hospitals has made to really establishing Geauga as the regional center for the east part of the UH area, which includes us way out here on the eastern flank, but also Ashtabula, Geneva, and Points West. And it's, UH has put a lot of resources into the development of Geauga as a medical center. Mm-hmm. With the introduction of radiation oncology and a lot of other things that are big ticket items. That reveals a real commitment. That also, I'm sure, and you could speak to this, but applies as far as the resources and infrastructure necessary to have a first-class OB unit. Absolutely. Because not every pregnancy goes smoothly.
Absolutely. So with Geauga, we encourage women, if they are 35 weeks or beyond in their pregnancy, they can deliver at Geauga, and then if they have preterm labor, they are evaluated at Geauga and transferred to a location as needed. But the vast majority of pregnancies go to term, and we don't have any preterm delivery, but Geauga is very well equipped to handle any of those emergencies that might happen. They have 24-hour services like anesthesia and respiratory therapy and things like that may be needed. So it's a great place to have a baby, whether you're at your due date or whether you're a little bit too early. So the vast majority of pregnancies go smoothly, but you certainly want to be in a great hospital when you happen to be that one small percentage of a chance that something dramatic happens during your labor.
Right. Now I had kind of a skewed view of that because where I trained in Indianapolis at Indiana University Medical Center, fantastic program, and part of that campus was the Riley Children's Hospital, which is the only children's hospital in the state of Indiana.
Oh, wow.
So you can imagine that joint was jumping.
Mhm.
I mean, it was an amazing place.
Yeah,
And
probably saw a lot of deliveries of babies that they knew had some issues.
major issues,
Mhm.
major issues. And we, you know, of course, being the referral hospital in the whole state of Indiana, we saw a disproportionate amount
Yeah.
of that sort of thing.
Mhm.
But it also makes quite an impression on you as to how sick those babies
Mhm.
are and how difficult those situations can be. And out here, of course, it's going to be nothing like that. It's going to be a very small percentage. However,
Mhm.
you pick that up, okay?
Right.
You know fairly early on, usually, that this lady may have problems with this pregnancy.
Absolutely.
Okay, and so if it gets to be, you know, one of those very difficult situations, would the patient, it depends on how much it surprises you. I mean, it depends on how much lead time you get. But, you know, if a lady who's at 28 weeks or 30 weeks comes in and it really looks like, you know, this is going to be tough to slow down, they would go to Geauga first and then be transferred?
Absolutely. So the goal is always in obstetrics to stabilize the mother and the baby, and if a delivery happens, you know, they work to, you know, get the baby the care they need, and then transfer the baby as needed to a specialized NICU. So
So the birth would be done at Geauga, the
birth
baby
would-
would be transferred to the NICU?
Absolutely. So mom and baby
Uh-huh.
would, you know, be together immediately post-birth. They would take care of the baby, and then once the baby is stabilized, they then transfer the baby to an appropriate NICU, usually downtown.
Something that, because we're talking about very specialized care at that
Absolutely.
point.
And, you know, we work really hard to follow all of the latest guidelines and the latest research to identify women who are at risk for preterm labor or identify women who are at risk for pregnancy complications such as preeclampsia, doing all of the latest things that we know can help reduce the risk of developing preeclampsia or reduce the risk of having a baby too early. And then, of course, we work hard to identify any obvious birth defects that may affect the outcome of a pregnancy. For example, identifying heart defects or limb defects, brain defects, kidney problems, all of those things. We send all of our patients to get a very in-depth ultrasound around 20 weeks that will identify any major things. And that's one of the nice things about coming to our practice is we try hard to you know, identify these things ahead of time, and our goal is always to work with the patient in identifying these things. So our nurses will take do an intake over the phone to identify, you know, the patient's history and see, you know, have you had a baby before? Have you had a problem before? What are some of the things that have happened to you in your past with your medical history? So we really work to have a very eyes-on approach to our patients to make sure that we're not missing anything. And sometimes things happen, even if we are on top of our game, and things happen out of the blue, and we work with the nursing staff at Geauga to make sure that patients are cared for in a timely fashion and things are taken care of quickly.
You know, what's amazing, my son, Stephen, was born in 1970, and it's amazing, Doc, how times have changed.
Oh, man.
I mean, she went to the doctor every, 3 weeks just to have her heart checked and blood pressure checked. They didn't do any of this stuff. Well, we had no idea when he was born. I was a nervous wreck because we had no idea if everything was going right back in those days. He didn't have all this technology, which you and I have talked about.
Oh, yeah, we have.
You know,
we have.
how it's changed.
Yeah, so, I mean, I think that an important message for people watching this to understand is that the technology, the ability to know about potential problems well in advance has really developed. And so when you're taking care of an expectant mom, you're going to know up front, probably well in advance, and know what the landscape is going to look like and be able to accommodate accordingly. Okay, so you don't get surprised all that much. Still do at times. I mean, it's part of life, but really reducing that. And I think that's very important to realize that when you come into this practice, all of that is brought to bear from the start.
Absolutely. And we know that some women don't want some of these interventions, and we work hard to create a plan that works for women according to what they think works for them. So we do see some patients who are Amish, for example, and they may not want certain interventions. And so, it's important to have good collaboration between the woman and her family.
So the woman really has a big say in.
Absolutely. We try hard to make sure that we're always counseling women on here are the benefits to having this, here are the risks to having this, here's why we think it's helpful, and here's why we offer it at our practice. And one of the newest technologies that's out there are genetic testing for babies just through the mother's blood. And so that's something that we're offering where we can find out if a baby has Down syndrome or some other genetic problem very early in the pregnancy, 10, 11, 12 weeks. And one of the benefits to that technology is that you get to find out if it's a boy or a girl that early with very, very clear certainty, much more clear than what an ultrasound tech can tell you about whether you're having a boy or a girl. So
Is that pretty common now where they know ahead of time if it's a boy or girl?
I think the vast majority of patients do choose to find out. Although, in my group of friends, I'd say it's about 50-50 of who's found out and who hasn't. I found out for both of my girls because I am extremely impatient, and there was no way I was waiting to the day of their birth to find that information.
So you didn't have that when my son was born.
Yeah,
Sure.
It wasn't until about the mid '80s that they really started doing obstetric ultrasounds around 20 weeks, or these anatomy scans, or typically what we call them, to screen the baby for birth defects. It wasn't really the standard of care unless there was some kind of a problem. And so, when I was born in the early 80s, no ultrasound for me, for my mother, and now it's the standard of care that around 18 to 20 weeks, a woman will go for an ultrasound to look for any major defects. And now these other technologies are coming into play as well, with just a simple blood draw from the mom's arm that will tell us even with more certainty if there are any genetic problems.
Amazing.
Yeah. Not all practices offer that, but we offer it to all women regardless of their age and regardless of their risk factors, because we know that for a lot of patients it would change things, or it would help us guide their care in a more clear way. If they had a baby that was going to have Down syndrome or some other genetic problem, we can then guide their care and involve specialists like maternal fetal medicine doctors as needed. So,
well, this fits in with one of the concepts that's really driven this show. Pat, you and I have talked about this almost from the very beginning, and that's the concept of empowerment.
Mm-hmm.
And what Marie is really talking about here is the bringing the technologies to bear, the advances in medicine to bear, to provide as much information to the patient as possible to empower them to make the kind of decisions that are right for them.
absolutely.
That's a very important concept.
Yes, and not all of our patients, like I said, decide to use all of the options that we present to them, but it's important that they have those options.
They
and then
get to make that choice.
Yeah, they get to make the choice. They get to formulate a care plan that works best for them. And that doesn't just apply to obstetrics, it also applies to gynecologic care. For example, women who are maybe perimenopausal and having heavy bleeding or something. There are a range of options that our office offers in terms of caring for that, and it doesn't just have to be surgery. There are other steps that we offer in advance so that women can make the choice that works best for them.
That is terrific. That is terrific. And so the additional hours that you're going to be having at the Ashtabula site,
Mm-hmm.
that's something that translates to greater accessibility for our Conneaut patients?
Absolutely. We see quite a few patients at all of our locations from Conneaut, and we know that it's important to try to offer a little bit more hours out here on the far east side so that patients don't have to drive as long, and it's a little bit easier to get in to see someone. So 5 days a month at this point we will be there. Dr. Ahuja does 1 Saturday a month, I do 2, and then I'll be doing 2 Fridays a month in the mornings as well out here in Ashtabula County. So.
All right, well, that is really excellent news for all of us out here in Conneaut. Now, I had talked to Marie before we came on the air today, hoping that she might be able to visit us again from time to time.
Absolutely.
And present clinical issues within your specialty,
Mm-hmm.
Gynecologic care or obstetrical care, either or both, that the kinds of things that are really important for the public to know. We have talked about this before. sometimes people, well, when should I call? When should I call? How do I know if there's something going on that I should call about? And so you can maybe address some of the different clinical issues that people are likely to run into.
Absolutely.
And maybe go into a little bit of an explanation about what these things are, and so that people can understand them, and also let them know, well, under these circumstances, it would probably be good if you gave us a call.
Absolutely.
That kind of thing.
And I'd love to hear from the residents of Conneaut to answer their questions if they have specific questions or topics they'd like me to address. I'd love to know what those might be. And
this is a request that we make basically on every show, that folks, you can call my number, you can email Pat, which is what usually happens, with questions, and we'll make sure that Marie gets them, and
absolutely.
and that she'll be back on a future show to address those questions.
Absolutely.
So please, we hope you take advantage of this. This is an opportunity for you to go right straight to the source and ask anything you want.
Yep. Just like when you're in school, there are no dumb questions. Ask away.
That's right.
I love to answer them.
Excellent, excellent, excellent. All right. Well, thank you so much for coming out to join us today.
Thank you for having me,
This is
both of you.
really exciting that you're going to be around to see us more.
Yeah.
That's great. That's great. Good information today. And if you do have any questions for Marie or Dr. Bryant, you can email me at nick1, that's NICK1, at suite224.net, and we'll get the questions to whoever.
Also, I'm sure that that Marie's phone number has been displayed during this video, and I'm sure that if patients have questions, they can feel free to call you as
Absolutely.
well.
Absolutely. We have staff waiting by the phones to
There
take
you
your
go.
questions.
There you go.
All right. Have a great week, and we'll be back next week. Remember, your health matters.